Fox 4 Health tonight. Every couple expects to have a healthy baby, but 1 out of 10 newborns needs intensive care. Fox 4 medical reporter Marilyn McCain shows us a big effort to improve that care.
Zoe Samuel arrived 6 weeks early, her tiny body very stressed by what's called a thyroid storm.
Got a whole head full of hair.
Zoe needed an IV for feeding and to get medication.
They put the central line in to keep from stressing her out even more and agitating her even more.
But there's risk in a tiny, thin-skinned baby having an IV.
They're at risk for an infection, which can lead to a pneumonia and even death.
Staff in the neonatal intensive care unit at St. Luke's Hospital is working to reduce those dangerous infections. It's one element of the 100,000 Babies campaign by Pediatrics Medical Group. Hundreds of neonatal specialists around the country collect and share data to see what works and what doesn't, to improve care for 100,000 babies over 3 years.
There's kind of that competition between physicians and nursing staff, and if somebody says they're doing it really well, then hey, I can too.
To reduce infections, St. Luke's decided to have only a select group of nurses put in central lines, with everyone following a checklist every time.
There's also great emphasis on hand washing, with signs at every room, and nurses have the power to police it.
When the nursing staff asked one of the surgeons if he had washed his hands, I knew we had made it.
Dr. Claflin says not a single baby in this unit has had an infection from a central line in the last 6 months, compared to 1 in 10 babies back in 2006.
They're just very meticulous about taking care of these things.
And Zoe and other babies have a better chance of surviving and thriving. Marilyn McCain, Fox 4 News, working for you in Kansas City, Missouri.
Besides reducing infections, the 100,000 Babies campaign is aimed at improving body temperature, nutrition, and medication use, along with minimizing the use of ventilators.
Working for you with